masks, and some have gone as far as saying that they've felt that they were being intimidated by others who weren't wearing face masks. So how important is it really to wear a face mask?
Okay, so first of all, the actual face mask that prevents the virus is the NP95 face mask, the one that is the highest degree. That's unfortunately not available. I think what one has to consider is balance the probabilities. So if any face mask, so first of all, the primary source of spread of this virus is through your breathing. And if we can minimize as much of that in terms of the respiratory droplets that we breathe out or we cough out, so covering your mouth when you're coughing, then we will make a big difference. So if we can stop this or minimize that risk by 80 or 90%, then that's fantastic. We will never do it 100%. And face mask is one of the tools that will help us to do that. Therefore, it is important that you do wear a face mask. It may not completely stop the spread from yourself to the other person or from the other person to yourself, but it will minimize it to a great extent, especially at close quarters when you're living in the same household. And it is embarrassing, but then on the other hand, think about your loved ones, think about your elderly. And sometimes if everyone is wearing it, then there is nothing to be embarrassed about. So that's that one strategy. And I think it's being more responsible rather than just feeling embarrassed. And nobody will say, oh, look at him, he's wearing a face mask. In fact, people will respect you for it if you are doing so. So I think that's quite important. The other thing, touching to your previous point, which is quite important, is that say you get infected from today. So today is day 0. Studies show that it takes up to somewhere between 4 to 7 days for you to actually then show the symptoms, if you were to show the symptoms of coronavirus. So on average, about 5.2 days. So if you don't show any symptoms, you could be infected and passing it on to everyone else in your household. And if you go out and meet someone who then goes back to their household, and you haven't been wearing a mask and you've been hanging around with them for a couple of hours, having a chit chat or going out and doing something, then effectively they've gone back not knowing that they've had the coronavirus from you, if those precautions weren't taken. And then they will be able to pass it on to their family. And that is the danger with this virus. That's what we call the R number. The R number is if one person gets infected, how many other people will he or she infect? So if the R number is 1, that means one person will infect one other. That one person will infect one other. If the R number is below 1, then you're likely to contain the spread, which is what we are trying to do by having social isolation, self-isolation, lockdown, and so on. The coronavirus has been shown to have an R number of 2 to 3. So if one person is infected, they're likely to infect 2 to 3 other people. Then imagine those 2 to 3 other people are likely to infect 2 to 3 other people per person. So there's an exponential growth of that virus. And the R number depends upon 4 factors. First, is anyone immune to it? Well, no one's immune to it at the moment. So that's outside our control. How long have you had the infection? Well, again, that's outside our control. But the 2 other factors are under our control, which is how long you are in contact with another person, and the other thing is what precautions are you taking. And if we can minimize those 2 things, then the number of people we spread the virus to other people will be less and less. And we're trying to get that below 1. And that's why it's important for young people to understand how important it is to take those precautions in overall as part of the bigger picture.
That was very informative. Thank you. According to some of my research, coming back to the face mask, the CDC does not recommend that people in the general public wear surgical or the, as you said, NP95 masks. these are in short supply, and one should be, this should be saved for the healthcare workers. So after the NP95 masks, which masks would you actually recommend? Do the masks that we normally wear, which are made from the clothing, are they just as safe as NP95, or would you recommend, what mask would you actually recommend?
Okay, so that's sensible advice by the CDC. That advice will obviously change as the supply increases. So the most effective mask is or FFP3 or N95, yeah? That is virtually guaranteed to stop the virus. Now, if that's in short supply, then we need to make it available for the people at the front line who are most at risk. And therefore, that's good advice. However, as I said, alluding to my previous answer, that whatever you can do to minimize the spread by covering your face, whether it be a surgical mask or whether it be a handmade mask or whether it be using a paper sort of handkerchief and you're covering your mouth. The idea is that the actual there's a barrier between you and the other person. So when you are coughing or you're breathing out, that barrier is maximized, so that there's maximum amount of resistance between you breathing out and passing the respiratory droplets and it going into the air and being breathed in by someone else. But you're right, in an ideal world, it would be nice to have NP95 masks and for everyone to wear it. But unfortunately, we live in the real world.
Brilliant, thank you. Another question that's come from our community, we have a few people that are cancer patients. Now their question is, are there different recommendations for cancer patients and also caregivers? Okay,
so cancer patients at the moment are under the vulnerable patients list. So they should have received a letter if they're actively receiving treatment for cancer, if they're palliative care or if they're having chemotherapy. And they should have received a letter from public health saying that they should basically be staying in their homes for the next 12 weeks. And that's because they are vulnerable. And they're vulnerable to COVID-19 and the effects of it. So their carers then, who are coming to care for them, need to take extra precautions as well. And those carers would need to be wearing, well, as much as they can in terms of FFP3, so basically gowns, masks, gloves, everything that, you know. But if they're household carers, then those household carers should be shielding as well, ideally, because they are living with that cancer patient and they're caring for them. There might be situations where if they have extended family networks, then they can deliver the shopping to them and so on, and it prevents those carers from leaving the house. But cancer patients have to be extremely careful. Obviously, there's different types of cancer. Some person might have had, for example, prostate cancer 10 years ago and they're fine now. That's a different category. Someone might have an active cancer treated only a year ago and they're still having some chemotherapy or radiotherapy, or they just recently recovered. They're a different case and they need to be more careful. So it depends on case-by-case basis. But overall, they are vulnerable patients. They should have had letters from public health and they should be shielding for a maximum of 12 weeks.
A sub-question from this is, a lot of our elders who have underlying health conditions, they have panicked and they refuse to go to the doctor surgery or hospitals for their personal illnesses. For example, if there is somebody who is diabetic and has had an infection and needs a bandage to be replaced, they hesitate, thinking that the hospitals and doctor surgeries are places where the COVID-19 or the coronavirus they could quite easily catch from going to the hospitals. Obviously, we've been informing the elders and we've told them that, you know, there are precautionary measures that are being taken place in the hospitals and in surgeries. But coming from a doctor, what would you say? And, you know, what would you say that so they feel at ease going to the hospitals?
Okay, so I think the first thing in this is that if you are ill and if you're not well, you should seek help. And you can seek help by a number of different methods. So NHS 11, speaking to your GP, and most GPs are doing telephone consultations, and they can even do video consultations. And if they need that person to be seen, then there are various centres dotted around the city where GPs, groups of GPs have collaborated, and they have set up these sites. They call them amber and red sites. But these people can be sent there